We have an article from Timcast News written by Cassandra MacDonald saying that a Matt Walsh producer got approved for removing his testicles in a 22-minute video call. I watched a Matt Walsh video on this last night, but he has a thread where he talks about it, and I'd encourage you to watch his video on it to get a full context. But he had a producer who called, what was this place called? Trying to remember exactly what it's called. Greg Ray. I'm sorry, I don't know if it's Ree or Ray, but Greg got on the phone with a clinic saying, "Oh, I used to have gender dysphoria, but it's kind of gone away and like kind of wish-washy and was like super unsure about it." He got approved for transition surgery, and he was saying he was on a Plume clinic. There we go, saying that he was on a medication but couldn't pronounce the medication name. Like he mispronounced it in the video call on purpose. And talks about how he got diagnosed, and there's other places, and Matt Walsh will touch on this, where they will write letters so that people just, can get the surgeries. They're really pushing it to the point where they're like, pay us and we'll write you whatever you want. So
yeah.
It's very reminiscent of that like college admissions scandal where it was like, pay us and we'll do what you want. It's like very reminiscent of that, except this is much worse because you're literally ruining your body. And obviously he's not gender dysphoric, and he's, as far as we know, he doesn't suffer from that. He's never claimed to, except in this video call. But basically was kind of like joking around and like basically saying like, I don't think I'm gender dysphoric. On his intake paper, he said he doesn't suffer from gender dysphoria. But they still gave him a paper saying, go neuter yourself, boy. Like, here you go. Like, here's the papers. Like, he's not a dog. He's not a cat. He's not an animal that can you just chop the balls off. Like,
yeah,
it's a whole human being. That's a whole life that you could ruin. And I, as a male, how do you feel about this, Chris? I'm just curious how that, thinking about that, how does that make you feel?
It makes me feel pain. I have like a ghost pain.
Yeah.
I have to agree. And I'm gonna put my own point out here real quick. I think the biggest reason why a lot of this stuff is being pushed, and this is from stuff that I've read online. It's a lot of this stuff can be paid through by insurance. A lot of insurance companies are paying this, so pharmaceutical companies really want to push this because insurance is paying for it. So they're getting a lot of money from a lot of these gender dysphoric people who, they may or may not be, but like these medications and these surgeries cost a lot of money, and insurance is paying for it. So these pharmaceutical companies are making a lot of money from a lot of these procedures. So.
Yeah, and that your point actually reminds me too. As I was watching the video yesterday, Matt Walsh does touch on that, and he says that that it's required by most, if not all, insurance companies to have a gender dysphoria diagnosis and like a letter to get approved and to get it paid for. So they're basically, I don't love all insurance companies, of course, but they're scamming the insurance companies, and this money that they're paying that could go to someone who needs, I don't know, whatever treatment. They're just using the insurance company to pay for it, and then the pharmaceutical industry gets a lifelong patient. Of course they're happy about that. And I'm not talking about, your local pharmacist on it, whatever. I mean, like big pharma, I'm not going to be like, oh, go yell at your pharmacist. Like they generally don't, they just, validate all the prescriptions and everything. And then, so for them, they could really care about this, but big pharma is like, okay, you got approved. Oh, okay. Well, here's your medication. Oh, well, guess what? You need to take this every single day for the rest of your life. So, it's so twisted that that's what they're doing. And everyone's not everyone, but the left essentially is defending it, saying like, well, someone suffers from gender dysphoria. Well, they said they did, but where's your proof? He literally said in the phone call that he did, but doesn't anymore. And then couldn't pronounce his medication. And she's like, oh, it's a tough one to pronounce or something like that. Like, kind of made a joke about it. And it's like, I would know the medications I'm on if that were me. At least, kind of how to say them with something like that.
One last thing about that medication, a lot of them are on like Lupron, which if you guys watch the Matt Walsh, What is the Woman, they go into it. But Lupron, and what he said is one, it's what they use for a lot of pedophiles as
Castration.
Yeah, chemical castration. But it's also been linked to cancer too. Like it's a very carcinogenic drug. So on top of that, they're going to have a cancer patient 10, 15 years down the road, too. A lot of these people who are on these drugs, like, we're going to see a lot of people, probably class action lawsuits and everything else, in like 10 to 15 years, because we're all
Yeah.
I mean, everyone's the guinea pig right now for a lot of this
Mm-hmm.
stuff. And
Yeah.
Yeah, and I know Chloe Cole, who was a minor when she, went through surgery, she's suing the hospital that did her surgery and like the companies that allowed it to
Kaiser.
happen. Um,
Yeah.
I
She's
know
suing
she's
Kaiser. She
yeah,
got,
yeah.
what's her name? Hermie Dillon's representing her.
Oh, nice, nice. That's
Yeah.
great representation. So yeah, I know she's one of the first people to really like break out and do that, and it's so monumental because she was a minor when it happened. I think she was 16 or something when she went through a surgery. She got her breast removed at 16 or something, like crazy, ridiculous like that. And she regrets it now, and now she identifies as a female, and she was born a female, and so this is one of those things where you see the regret later. And they were just saying, well, we just write these, and Matt Walsh also had a Twitter thread on it with like 20 tweets, if you guys want to check that out as well, where he shows all the evidence. So this wasn't just something like Daily Wire would not post a story like this without thoroughly going through the steps to get the proof they needed.
Hmm.
So that's important to remember, is that this is like not an over exaggeration. It's just they went the route that they were told to do. I mean, I forget who it was, but somebody, I think it was also at Daily Wire, called and like could make an appointment with Planned Parenthood to get put on testosterone or estrogen or something like that. It was some kind of transitioning. This was like a year ago now, so it was a while ago, but someone called and basically was able to get an appointment within 5-10 minutes on the phone.
Hmm.
And then there's people who could go into the gender clinic and get, a prescription after one visit without a psychologist, just the whoever's there that day working at Planned Parenthood.
Well, I don't know if you guys remember, but about 9 months ago now or so, it was the Daily Wire. I'm pretty sure it was Matt Walsh too that they broke the story, kind of what Derek was saying about the insurance companies. And you understand the concept of the military-industrial complex, right? You start the war because you're selling the weapons, and then it's a cycle. You make the money.
It's the same thing. It's just the medical
Medical
industrial
industrial complex.
complex.
Yeah,
Yeah, I
exactly.
guess.
You diagnose them with the fake disease, that you sell them the surgery, which you need to keep up on, and the boom, 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 and it's like you've got a customer their whole life.
And then the more they do
But
that, the more people will think, well, I'm like that, and then they're going to do it. And so they gather more customers as time goes on. And no one wants to be a patient for life. No one wants that.
yeah,
Like, God,
yeah,
no, I don't want to deal with doctors the rest of my life. I mean, I will if I have to, but like, I wouldn't go out of my way to be like, yeah, let me come in for an appointment every month because I don't know, wanted to play with a truck one day when I was a kid or something. Like, that's just not, and the parents making those decisions, oh my God.
that's
Oh.
if you have an actual problem. That's not if the person on TikTok told you have a problem. You
Yeah,
know.
exactly.
But so what the thread that he had basically uncovered was exactly what he was saying, that the insurance companies, like the hospital, he had somebody on camera that was basically saying, yes, it's like these hospitals get funded just solely off of these gender affirming surgeries and the therapy and the this and the that, and yeah, it's like it's totally tied into the insurance companies.
And it's so bad. It's just, I
Hmm.
mean, it's hard to have any respect for these companies that do these things and
Hmm.
perpetrate these lies essentially, and the parents that put their kids on transition, hormones from the age of 5, I don't know, whatever, whenever they're
Yeah.
apparently allowed to, identify their sexuality, which is just bizarre to me that we're not like thinking about that, I don't know, logically. And yeah, and I'll have more kind of updates on that topic specifically in a few weeks here. I'm not going to disclose anything other than we'll have more to say on it, so that for not just my safety, but the safety of others at the event as well. I wouldn't want anybody to get hurt at any capacity.
Yeah.
So it's a 22-minute phone call. I mean, that's like me calling my dad to tell him how my day was. Like, that just baffles me that like I sometimes call my dad and we'll talk for 20 minutes. And okay, like it's amazing to me that in that time someone could get diagnosed with gender dysphoria and be told like, hey, you're cleared for this surgery. with no
Yeah.
proof of a past, like doctor visit, a counselor. It's not like he went to a counselor growing up and he got to 18. And this is where, like, I'm not of the, they can never do it. But, like, you look at Blair White, and she suffered for a while. She lost her father, I think, at like 18, 19, something like that. And held off her transition because her mother was like, she says, I don't want my mother to mourn the loss of her husband and her son. So I waited until, and that's someone who really suffered. You can tell this person went through years and years growing up, but then was so selfless and holding off that care for themselves. So you're telling me this is life affirming, whatever the heck they say, you need it or you're gonna die kind of thing, like they're gonna kill themselves. I think someone who went through that big of a loss in their family and still managed to put their needs on hold for other people, or to make sure that it was, the right thing to do and the timing is right, that's more noble, in my opinion, than someone who just wants to fit in and wants to, they think it's the cool thing to do. I have a big problem with that. And that's why Blair White's one of the only people in that community that I can truly respect, which I wouldn't even put her in that community, to be fair. She doesn't put herself in that community, but
But if I'm not mistaken, Blair didn't get surgery for
not
anything.
bottom
I mean,
surgery.
yeah, the facial feminizing surgery. Yeah, not the
Not the reproductive. Not the, yeah.
yeah.
No. And Blair has talked about this openly, saying, I don't even know if I'm going to. It's just not. I'm happy with how I am now, and so I'm not sure if I want to go down that path. But very open about it, and admits that, like, I present this way and I'm happy with it, but I'm also a male. She admits it.
Mm-hmm.
And I use she with Blair because there's no way you can look at Blair and tell me that's a man. Just, if you didn't know, you wouldn't know. Okay, that's all I'm saying. So, one of the rare cases where you're like, okay, I would have never guessed. Like, ever. Never.
Before I knew who Blair was, I sincerely thought Blair
Blair.
was a woman.
Yeah.
Yeah.
Yeah, and so that's one of the cases where I would say, like, I'm not going to say he, because I can't. With Blair, it's just one of those people that for me would be very difficult to lump into that group, because Blair, speaks against that entire ideology and says, like, this was my path, but it's a very rare path. You shouldn't have to, not everyone should go down this, especially children. And so I respect that a lot.